So hello, my name is Al Maza, and I'm going to talk about Canada's healthcare system on behalf of my French degree. And I've been a citizen in this country since 1968, and that was a very, very short time after the health system in this country was created. It was created in the late 50s, I believe. And it's a Canadian system, but it's actually administered by Canada's 10 provinces, so it's a responsibility of the provincial government. The federal government oversees continuity across provinces and participates in the financing across the country. That's the federal government's role, but policy and administration is provincial. Canada's healthcare system is considered single payer, and what that means is that you do not directly pay for services, nor are you billed for services. It comes out of general tax revenue, general budget attributed to healthcare, and the citizens finance this through their taxes. There is a possibility for provincial variations. Certain provinces have supplemental taxes, supplemental fees. The extent of coverage varies a little bit, but in general, single payer means you improve your eligibility through residence and citizenship, and then you are not billed for services. This healthcare system, I consider it to be a marvel. It's something that's very impressive in that it's from cradle to grave coverage, and it allows citizens to enjoy health coverage without financial penalty. It is a system that does have some flaws, and some of the flaws are that it's not like any insurance scheme. It is not necessarily amenable to being to dealing with massive behavioral health consequences. So, for example, if you have large segments of the population that adopt lifestyles that are very unhealthy and that they have to have recourse to the system can rapidly become overloaded. Canada's system costs a lot of money, and it's basically because of the post-war generation adopting a lifestyle that led to an increased requirement for healthcare through smoking, obesity, and so on. So its major flaw is its high cost, which limits its accessibility, and so there are rationing along the lines of wait times. I think that's the main flaw. Everything else in our healthcare system is very good, from access to technology to the professionals we have at our disposition. Thank you.
Hi, my name is Stephanie Messina Pacheco. I am a microbiologist slash researcher. I live in Montreal, Quebec, Canada. So how does Canada take a role in the healthcare system? So you don't have to pay every time you go see a doctor. We pay per year, and every time you go it's free to see a doctor. The wait times might be a little longer, but at least you don't have to pay every single time. So in that respect, it's I find that the role that Canada takes in the healthcare system is a good thing. So do I find healthcare expensive? No, I feel like the healthcare is very inexpensive. Like I said, we pay per year and not every time we go. The only thing is if you need to go pick up a prescription at the pharmacy, then you have to pay, but healthcare always pays a portion of that. So again, it's less expensive. Whereas I've heard in many different places you have to pay thousands and thousands of dollars every time you need a procedure, and it's not like that here. So is there one thing that I can change, and what will that be? I've seen a lot of doctors over the years, And I think that the one thing I would change is the time allotted per patient. Now, I don't know how it was in the past, but now usually it's either 15 or 30 minutes where I go. And I find it's not a lot of time to cover all the problems and questions that I have. Also, sometimes people go way over that 15-30 minutes a lot of times, so we're usually waiting in the office for a lot longer than, let's say your appointment was supposed to be at 2 o'clock, and sometimes you're still waiting to see the doctor at like 5. So that would be the thing I would change. I would change the allotted time and change it from like half an hour to maybe an hour, depending on what you need to talk about. I think they should ask you in advance how much time or how many questions you have or how many issues you have. That's it. Thank you.
Hi, my name is Katrina. I'm a researcher here at the NRC in Montreal, Canada, and I'm here to answer a few questions about our healthcare system in Canada. So the first question is, how does Canada take a role in the healthcare system? So in Canada we have a universal healthcare system, which means that it's basically a single payer system where the government basically funds our healthcare. However, it's not free per se because we do pay for the healthcare via our taxes. So that means that not everyone is paying one fee. If you earn more, you'll pay more. If you earn less, you'll pay less. So in that way, I guess it's kind of beneficial, because even though you may not be contributing the same amount of money, like in monetary value towards the system, you are technically supposed to receive the same level of care. Whereas I think in the US, if you have access to more money, you probably have a higher chance of getting better care. So that's the difference between our healthcare system and the US system, which I guess is mainly privately funded. Ours is funded by the government. So the next question is healthcare expensive? I would say no, it's not generally expensive. But if you are paying for services which are not covered by healthcare, because not all the services are covered, it could be expensive. So things like dental are not always covered. Things like prescriptions may not always be covered. If you do have like some kind of coverage from your job, that can help as well. But usually it's not 100% covered. So at the end of the day, you might be paying for some services. So it could get expensive if you have, I guess, a lot of health problems or you have a lot of care needs. Some kinds of cancer treatments, for example, are not covered, so those kinds of bills can add up really quickly. So generally it's not expensive, but it could be depending on if you have, if you're not really healthy and you have a lot of health problems. The last question is, what is one thing you would change about the healthcare system? I think the main problem that we have right now, and it's probably echoed by most people, is that we wait a long time to see a doctor. So even though we're not necessarily paying money to wait, sometimes you can spend 8 hours or more waiting for a doctor in the hospital. Sometimes even if you have an appointment, you can also spend a lot of time waiting. So it's kind of a lot of lost hours for work, etc. So that would be something that I guess we could improve on, and probably the way we can improve that is by having more doctors available to see patients. Another problem is the wait time for specialists. We have a huge problem with that here in Canada. Sometimes it takes months before you can see a specialist, and for people that have some serious health problems, that can be the difference between life and death. So if I could say that there was one thing we could change, I would say it would just be in general access to doctors and specialists.
Hi, I'm Tricia Dubrock. I work at Louisiana Public Facilities Authority, where I'm Service Vice President of Administration and Student Loans. First interview question, how does America take a role in its healthcare system? From my standpoint, it plays an integral role in just our everyday lives. It impacts us. It's so critical for everyone to have health care. The Affordable Care Act did help, or the intent was to make it affordable for everyone, but in reality, I'm not sure if that actually occurred. Is your health care expensive? Healthcare is very expensive. Fortunately, my company pays 75% for its employees as well as for their families. So for me, from my paycheck, it's not that expensive, and our coverage is very extensive. Like our copay is only $10 per health visit. So we're very fortunate, but most Americans are not. If you could change one thing about the healthcare system, what would it be? I would improve the quality, but I also would make it either free or very affordable for everyone.
Hey, I'm Steve Chadwick, and I am a sales representative here at Elite Import Group in Baton Rouge, Louisiana. And I think that the role that the American government plays in our healthcare system probably could best be defined as the Obamacare Act, which was instituted under his administration while president. It definitely has its problems. Healthcare is a big problem here in America, and the government is trying to do what they can to help the people. I believe there's not yet been a really working answer to the healthcare problem here, but I trust that our politicians are doing their best to come up with something that will work for the American people. In terms of the expense of healthcare here in America, I find it to be very expensive, actually, and that's one of the problems that needs to be addressed. It needs to be fixed. Seems like whether you pay through the help that's in place now through the Obamacare, or whether you pay through a different means, it's very, very expensive. And so preferably that is something that'll be addressed as well. And then thirdly, the thing that I would do to be able to change, or what is the thing I would do, excuse me, I would like to see cost cut. If there's one thing that I could change in our healthcare across the board here in America, I would lower the cost for the American people, because it is just so very expensive. And so I hope that helps.
Hi, my name is Titan Alone. I am a postdoc at Princeton University and soon to be a professor of economics at UC San Diego. I'm supposed to be answering 3 questions today about the U.S. healthcare system, so I'm going to jump right into it. The first question is, how big is the American government's role in the healthcare system? So currently in the United States, I think the U.S. government mainly gets involved in healthcare for the poorest and neediest people in society. Overall, I think they're doing a good job there, but more can be done to expand that coverage to middle-class working families who are still struggling with healthcare costs but currently don't qualify. The second question is, do you find your healthcare expensive? Yes, I find my healthcare very expensive. I find everything about living in the United States very expensive, and especially healthcare. I think overall, if you're not battling some serious disease or have some chronic long-term treatments, healthcare is actually very expensive. Though I know from experience, when a family member gets stuck with a very serious long-term consequence, then healthcare can be a lifesaver. 3, is there one thing you would change about your healthcare? What would it be? I would make it cheaper. My own personal healthcare, I would make it cheaper. I would also maybe like to have more flexibility on the kinds of coverage that I get and the type of premiums that I pay. Currently, I don't have much flexibility, but since I'm young and in relatively good health, I would opt for a more minimal policy if I could. And that's it. Hope that was helpful.